And with this, I'm going to turn it over to Dr. Maha, and we're going to talk about social determinants of health, which I know a lot of us focus on in different areas. I'm very excited about this. And Maha, send it over to you.
Thank you so much. So next slide, please. Hello again. So my name is Maha. I'm assistant professor at the College of Nursing, and I'm a public health nurse by training, and my research focused on adolescents and young adults from immigrant and minority groups. And some of my work focused on stress-related factors that can influence cardiovascular health and diabetes. Some of the recent projects that I did focused on the Arab American community, a study that I would like to share the preliminary results of with you tonight. So I did some work around psychosocial stress, including bullying, victimization, discrimination, childhood adversities in relation to chronic stress biomarkers, particularly hair cortisol, and all these factors in relation to health outcomes, including physical and mental health. I also did work around parent and adolescent dyad relationship dynamics in relation to psychosocial stress and health outcomes. My previous work during my PhD and right after that focused on bullying victimization among Arab American adolescents and its effect on their physical and mental health. Currently, I'm working on a project that focused on Arab American and African American young adult medical mistrust and in relation to their readiness to be adults. Next slide, please. I have just concluded a study, and I'm very proud to share the result of this study because it was done in collaboration with Access, and Access and Wayne State got together to provide funding for pilot data, and it was very competitive, and we luckily got funded to do our study, and this study focused on metabolic syndrome. And we looked at psychosocial stress, also mental health, depression in particular, in relation to metabolic syndrome among adolescents and parent dyads. This study was done among the Arab American community. First, let me explain what we mean by metabolic syndrome. It's simply dysregulation on multiple cardiovascular and metabolic parameters. It's include obesity, hypertension, decrease the good fat in the blood, increase the bad fat in the blood, and also high blood sugar. What is important about metabolic syndrome and recognize those, the criteria for it and factors in metabolic syndrome, that it's a predisposing or like a stage before people move into the chronic disease. So it's a strong predictor for diabetes, for cancer, and also for stroke and heart disease. It's very important to recognize people who experience those criteria and try to intervene before they move into the chronic disease stage. In terms of Arab American, there was the research studies done regarding this topic among this group. Only few studies looked at these factors, and mainly were among adults. So currently we know that the Arab American adults have higher mortality rate in relation to cardiovascular health when compared to non-Arab and non-Hispanic whites. Also, Arab American adults in Michigan present or reported more heart disease risk factors, such as increased blood pressure, increased glucose levels, and also increased the bad fat in the blood. Arab American women had higher levels of triglyceride and lower HDL, which is the good cholesterol in their blood, when were compared to Black and white women. However, those studies were actually relatively small sample studies. Also, overall, Arab American ages 20 to 75 were studied in a study that looked at 3 large metropolitan areas, and 23% of them met the criteria for metabolic syndrome, and women were at greater risk when compared to men from Arab American group. If you look at the corner, I present like a very just to show how metabolic syndrome can increase mortality rate among individuals. Despite the weight, metabolic syndrome increase the mortality risk. And if you look at the top line, it's actually people with normal weight who have metabolic syndrome. So they meet at least 3 of the criteria for metabolic syndrome. So as you can see, metabolic syndrome increase the chance for chronic disease and actually double the risk for mortality rates. Next slide, please. So due to lack of research on the Arab American adolescents and their parents, and looking at that unit, the dyadic unit, we proposed our study. So I'm presenting the data based on 70 families, but we ended up having 79 families. We're still adding the data and trying to do more analysis, but these are just preliminary results that we were able to share. So among these 70 families, we have 17 adults who met the criteria for metabolic syndrome, and we have around 6 children who met that criteria. However, if you look at individual risk factors, the percentages were alarming for me. So if you look at children table, as you can see, around 29% were actually or had increased waist circumference, which is a good indicator for obesity. Elevated or the second important finding was the low HDL, which is the good fat, and it's important for children in that age to have enough because it's part of their hormone composition. So we had around 69% of our children participant had low HDL. Hypertension was, or 17% of our children had hypertension. So, just looking at the relatively small sample, we had 70 families included here. These are, concerning percentages. If we look at the parent sides, you can see that these percentages even higher. 75% had increased waist circumference. I didn't share much of the demographic for the sample, but we had majority females than males. So we had more mothers participating than fathers. And personally saying that I conducted the home visits to do those measures personally in all these, with all these families. And I really have that observation too, that a lot of the mom I met felt that their weight is high and they needed to do something and they didn't know how to do or what to do, and they want to check, or they use the study to check on their status. As you can see, we have around 53% with low HDL, hypertension around 34% of our parents, presented hypertension. Also elevated fasting glucose levels were around 10%, and we removed the outliers here. So this is like the final results. I didn't include the fasting blood sugar on the children's side because we didn't have any. Okay, so the next slide, please. just the primary analysis, and we looked at associations. Basically, we found that the relationship between kids and their parents were very important. Kids who experienced parental conflict and reported higher discrimination, higher acculturation, and depression scores. Now, which one comes first? We're not sure, because this is a cross-sectional data. Like if the conflict at home, reflected on other stressors, or maybe stressors, those psychosocial stressors really led to more conflict at home, but we know that they are associated. Another thing, was very important for us to look at that children with who had a better relationship with their parents, so they were had more involvement and warmth from their parent side, they reported less depression scores and less psychosocial stress scores. So basically, the parent-to-child relationship was very important in the psychosocial stress relation to depression and to health outcomes. Again, this is just preliminary data, but we need to look more closely for other demographic, how they play a role in this relationship, like immigration status or, socioeconomic status. So these are still, in process. The good or the take-home message from our study that we need to recognize those psychosocial stressors among Arab American kids and their parents. We need to recognize that acculturative stress is an important factor to consider when we look at their mental and physical health, discrimination, and all these psychosocial experiences really influence their health. Also, we learned that mental health and physical health cannot be separated for kids and for their parents. So it's important to consider mental health when we're looking at physical health, for these adolescents and their families, and vice versa. One thing we found very helpful in our study, that we were able to identify some of the protective factors that we can use moving forward for intervention purposes, that the family is important, and the parent-child relationship might be a key to reduce stress and to enhance health outcomes, mental and physical. Next slide, please. And of course, just like every study, we ended up with more questions than answers, and really doing this study in collaboration with Access. Sorry, I was just looking at the chat. So we learned that we need more research and data. Our study is a small study, but we definitely need more longitudinal and larger studies to be conducted. We need more data to base our practice and intervention on. The importance of working with the community and having community engagement for such work to be successful and also reflective of people needs, and the importance of multidisciplinary collaboration. So we looked at biological measures, we looked at survey, and we looked at mental and physical health. Yes.
Busy, but good. Good.
Okay, so I think we're gonna revisit this conversation again about what need to be done. But I just want to highlight these findings from the small project that I just concluded. Thank you so much, and I'm ready to answer any questions in the breakout room.